All right, no trouble at all. Happy to be here. So, today we're going to be talking about managing sensitive data. So, we're going to be talking about that in terms of the social sciences and the humanities. This is particularly going to be of interest to anyone who's dealing with human data. So, at some level, all research participant data is sensitive. That's especially the case if you're videotaping, audio taping someone, but it's also the case if you're interviewing them, if you are collecting their responses to questionnaires. So all of that data can be sensitive. So hopefully this speaks to at least a few of you in the crowd. So essentially, these are my objectives for today. So I'm going to give you an overview of Canada's data management landscape. So part of the reason for that is that things are changing rapidly and fundamentally in Canada right now. And so I think it's worthwhile for you to know sort of the big picture of what's happening so that you understand why this is becoming so important and why you might be hearing more about data management than you ever have before. We're also going to talk about the TCPS2 data management requirements. So if we're thinking of the overview of Canada's data management landscape as all the happy, positive reasons why you should start to think about data management, the TCPS2 changes are maybe the stick that's behind you in terms of why you should care and be concerned about responsible data management. And as many of you will know, research doesn't just have to be funded by the Tri-Council in order to have to meet TCPS2 requirements. If you're doing any research in an organization that is capable of administering Tri-Council funds, then your research has to live up to those requirements, whether or not it's funded. So if we're talking about organizations that are capable of administering Tri-Council funds, we're talking about most universities, we're talking about colleges, we're talking about health research institutions and RHAs. So we're talking about a lot of the research that happens in the country are going to be beholden to these requirements. And then finally, after all of that, I'm going to give you access to a data management toolkit that is actually quite a useful set of four tools that can help you to manage your data responsibly. So starting with Canada's research data, what does the research data landscape look like today? So one of the big changes that's happening in Canada right now is what we've been calling the digital research infrastructure. So digital research infrastructure is the collection of tools and services that allow for researchers to turn big data into scientific breakthroughs. So all of the things that exist in order to be able to support you in the responsible use of your data. So some of the key elements to the country's digital research infrastructure include a digital network for research and education that allows researchers to share their data and collaborate, data management and data management requirements that allow research to find and access data. Another key element is research software that enables researchers to access and use their data. And finally, we have advanced research computing. So this is really the future of data and allowing for the capacity for us to analyze massive amounts of data. So these are some of the key important pieces of infrastructure that are associated with good data management across the country. So essentially, here's what things look like right now with regard to these fundamental components of research infrastructure and digital infrastructure. So we have the Government of Canada. The Government of Canada oversees CANARI, and CANARI is an organization responsible for research and education when it comes to digital and data management. We have Research Data Canada, they're involved in data management. We have CARL, the Association of Research Libraries, they're involved in data management. We have the Canada Foundation for Innovation, involved in research software. We have Compute Canada, which is, as you know, involved in advanced research and computing. And then we have a million other little organizations, data repositories that make up the ecosystem. So the ecosystem as it stands right now is tremendously complex, and it's also very diffuse. So there's lots and lots of little organizations that in many cases are federally funded, or at least funded with government dollars, but that make up a vast network of organizations. So some smart person out there took a look at this and said, there must be a better way. So essentially that is what's happening right now. So there is a new organization. So they're calling it here in this, the new DRI organization. We've been calling it NGRIO. And this organization recently received $575 million to take all of this diffuse ecosystem and put it all together under one major organization. So we still have Canary that is responsible for education, but this new DRI is going to absorb a lot of these organizations, and they will be responsible countrywide for data management, research software, and advanced research computing. So this is a really big deal. We're talking about a lot of money. We're talking about a lot of people getting hired in this area, and an amalgamation of what was previously a diffuse and frankly, in some cases, difficult to navigate organizational infrastructure or ecosystem. So the new Digital Research Infrastructure Organization is a national not-for-profit organization that is playing a critical role helping to advance the establishment of researcher-focused, accountable, agile, strategic, and sustainable ecosystem for Canadian researchers. So there are a bunch of pros to the fact that this is something that's going to exist now and really is coming into existence as we speak. So Canadian researchers will have the opportunity to access the tools they need to conduct leading edge research. So a lot of the tools you might use to analyze your data will be available through this organization. Researchers will be better equipped to be able to optimize research data and generate cutting edge knowledge and ideas. So again, we have this all in one space. We have the opportunity for collaboration. We have the opportunity for new ideas to come to the forefront very quickly. There are going to be world-class digital tools and services available that are going to enable researchers to gain new research insights. There is a cohesive national vision for future investments, leveraging contributions from federal, provincial, institutional, and private sector sources. Again, getting involved in this organization proffers a lot of opportunities. And one of the opportunities there is the opportunity for investment. So people are interested in investing in research, and that includes, of course, social sciences and humanities research. And so this gives an opportunity for all of that research to be amalgamated and for investors to consider it. Another pro is an agile and responsive DRI system that's able to respond to the emerging needs and opportunities within the research community. So one of the things that can be a little bit frustrating in terms of data management is that often we think about the privacy, the ethics that are associated with responsible data management, and those things can move quite slowly. And unfortunately, that means that sometimes research data becomes inaccessible or can't be used to its fullest potential because of the restrictions of the system. So having one overarching organization that's governing all of this allows us to pivot quickly and to make the best use of this data that we're collecting. So I actually have a little video. So this is a video that came out of what we call the consent design jam. So this was talking about iterative consent and how important it is for data to be amalgamated in order to be able to modernize the way that we do our research. So while this video is focused on things from the healthcare world, it can absolutely apply to things in the humanities and social sciences, which do often intersect with healthcare. So I'll show you this little video just to see what happens when data is managed really, really well.
This is Andy. One day, Andy will help find a cure for cancer, and he'll do it on his lunch break. An app on his phone will tell him that a technology company or research study is looking for health data from patients like him. He'll make the choice to donate his personal health information for the greater good. A few months later, he'll get an alert that his data was used to create life-saving solutions or enhance healthcare. A story like this isn't just fantasy. The healthcare system is on the verge of a consent revolution that could change the way medicine works by letting patients manage their health data the same way they manage their bank accounts. But we're not there quite yet. To modernize consent, we need policymakers, clinicians, researchers, patients, and entrepreneurs to get together to build a new platform, one that gives patients the power to control and manage their data. Want to learn more? Check out the report, Your Data, Your Choice, on modernizing consent. And one day, you too might be a part of changing the face of healthcare.
So while this might seem like it's a little bit far away at the moment, it actually is right around the corner. And the new NGRIO organization could be a big part of this. And so while this is talking about a repository of data that would be associated with patients that medical researchers can then access, it would be very easy to imagine a repository of data or a repository of interested participants that would like to participate in social sciences and humanities research. So for instance, if you have, a repository of contact information for breastfeeding mothers, all stored together in one place and accessible to researchers, then if you want to do research on that population, you'd already have a ready-made way to contact those people. So this is just one small example of what can be done to innovate when it comes to the responsible management of data. So when data is managed responsibly and clearly, it can be used for so many more things than if it's locked away or if it's poorly managed. So these are all of the kind of positive things that we're thinking about when we think about contemporary data management, as well as this new organization. But there are other new things that are happening in the ecosystem as well. And one of those is Tri-Council policy. So we're going to talk just a bit about that. So the Tri-Council currently has some guidance on digital data management and data management more generally. So there is the Tri-Agency Statement of Principles on Digital Data Management. So this is not a policy, it's not a component of the TCPS2, you're not beholden to it. It is simply a set of suggestions, really. That being said, there is a draft tri-agency research data management policy, which has been out for consultation, as well as a summary of the consultation. And so this is intended to launch as a permanent policy and a policy that researchers will be required to meet. So this is something that really has been promised to us for a long time now. I would say we're getting into the years, and unfortunately it keeps being pushed back. That being said, I have heard from several people who are involved in this industry that fall of this year may be the time when this policy launches. And then there will be a graded process while this policy is being put into place and while organizations and universities are being offered the opportunity to meet the policy's requirements. So it's not just like the policy is going to drop and everybody's going to have to meet those requirements immediately. But this is something that will come into place and that researchers will be required to follow. So why are the agencies developing a data management policy? There's a number of reasons for this. So there are a number of good reasons why we should require that researchers manage their data effectively. And the long and short of this policy really is going to be that researchers need to provide a detailed data management plan. So basically from the time that you start to collect your data through the data lifecycle, to when you destroy your data, you're going to need to step by step explain how you're going to manage it and how you're going to manage it safely, securely, and responsibly. So why are we going to go to all this trouble to require that people do this? Well, there are a number of reasons. So the agencies have a responsibility to ensure that the research they fund is conducted according to the highest standards. By adopting this kind of policy, the agencies aim to contribute to a future research culture that sees strong data management as an accepted signifier of research excellence. So this is something that I really believe in as an ethicist and a person with a background in privacy. I share a lot of the concerns that people have with regard to access to data. We want to make sure that it's not being accessed or used irresponsibly. We want to make sure that people's privacy and their rights are being respected. At the same time, I feel that there's really an ethical tragedy that we see when data gets locked away and data can't be used for future uses. It can't be made as much use of as possible because our policies haven't lived up to where we are in terms of research. So I think the idea of making research and making your data searchable, available, while maintaining privacy and ethical compliance is a really important step into the future. So strong data management as an accepted signifier of research excellence. Another pro to this policy is that more Canadian data sets will be cited. The more responsibly your data sets are managed, the more clearly you can access them, the more likely you are to be cited. Canadian researchers recognized and rewarded for excellent data management. So this is a really important part of this policy, is it can be difficult to convince anyone to do anything that can be seen, especially as like a little bit onerous or taking their time and resources, if there's not a reward that's associated with that. And sometimes the reward of well-managed data is not enough. So having this policy in place encourages us to then reward and recognize those who manage their data excellently, which is not necessarily something that we do a whole lot of right now. Another pro to this policy is that Canadian researchers will be equipped and ready to engage in international research collaboration where data management requirements are becoming the norm. So as many of you will know, if you're getting research funding in the United States or if you're getting research funding in the UK, as it stands right now, you must produce a data management plan that talks about from end to end how you're managing your data. Canada is actually quite behind on this requirement. So if you're doing work with partners in the States, if you're doing work with partners in the UK, you already had to produce this documentation. So this is really just bringing Canada sort of up to par with what other countries have been doing for years. Canadian research institutions are ready to support the management of the data their researchers produce. So this is another huge pro, which is that by making this an organizational and institutional requirement, part of that requirement, actually as written in this document, is that your organization has to support you. So in the first pillar of the adoption of this policy is going to be the requirement that your university has policies, has resources that will help you create your data management plan. So right now, if you want to create a responsible data management plan, you can absolutely do so, but you're kind of on your own in lots of cases. Or if you're being offered resources by your university, that's out of the goodness of their heart. So we really are creating a requirement here for organizations to support you in what can be a complex task. So an increased ability for research data to be archived, found, and reused to support reproducibility, the responsible conduct of research, and fuel new discovery and innovation. So this is the big one for me, is that so often, and actually I have a little video when I have a longer time to give this presentation that I show, that talks about sort of irresponsible data management and sort of makes a joke about the way that some people store their data. So people who will store data with titles like field 1, field 2, they'll save their documentation with names like Sam because Sam is their collaborator. So you can imagine if somebody is asking for access to that data so that they can reuse it to try and reproduce the work that you did, or so they can use it for a secondary use. Things like naming conventions become really important and can actually make it impossible to reuse that data. So by requiring right from the get-go that things are handled responsibly and ethically and clearly, this allows for more reproducibility, which allows for new discoveries. So there really is a tremendous benefit here. So as I said, when I have a bit longer to do this, I show this video, which makes me laugh hysterically as a data nerd, but I feel like probably not everybody finds it as funny as I do. So if you want to, I believe we're gonna share these slides after my presentation, and you can feel absolutely encouraged to go and take a look at that video if you wanna laugh about poor data management. So, we've talked a bit about all the positives. We've talked about Embryo. We've talked about all of the things that are changing in the data landscape in Canada right now. We've also talked about the forthcoming TCPS2 policy that is going to require that researchers responsibly manage their data end to end. And so now what I'm going to do is I'm going to talk with you about a data management toolkit. And this is actually a toolkit that I produced when I was working for McMaster University. And since then, we've created essentially an open source set of documentation so that every organization, every university, every healthcare institution that wants to adopt these resources can. So I'll introduce you to these resources. And if you think this is something that your organization might be interested in making use of, or if this is something that you'd like a copy of, I encourage you to get in contact with me and I can provide those to you. And there's actually a working group that's associated with the adoption of these 4 policy or educational tools. And it's currently 70 member organizations strong, including a ton of major universities and research institutions and healthcare institutions. There's even a municipality that's adopting these. So even if you're interested in this, it may very well be the case that you have someone from your institution who's already on that working group. And so I'm very happy if you get in contact with me to hook you up with whoever that person is, because you may have a colleague, a friend who's also interested in data management and you may not have known. So first, the problem. Where did these tools come from? So essentially this happened when I was working for the Health Research Ethics Board at McMaster University. And we found that there was a section of our application when people were applying for their ethics approval that researchers had a tremendously hard time with. So this was question 25. So question 25 is the question about how are you going to manage your data? How are you going to manage it when you're collecting it? How are you going to transfer it? How are you going to destroy it? And researchers had a tremendous amount of trouble with this section. We were always going back with comments on this section. But not only that, the members of the Research Ethics Board actually had a lot of trouble adjudicating this section. So they didn't even know, this person says, hey, I'm going to store all of my interview data on my personal laptop computer. I'm going to keep it under my bed. And the Research Ethics Board members would go kind of look at each other and say, well, I don't know, is that appropriate? Isn't it appropriate? So we had this issue where not only did the researchers not know how to fill out this section, but the administrators, the adjudicators also didn't know what they were looking for. So what we did in response to this is we developed a solution. So these are broadly accessible digital data management, education, and policy tools. So these resources were based on extensive research. So we actually did an original qualitative research project where we interviewed researchers, we interviewed research ethics board members, we interviewed other stakeholders, and said, what are your questions? What are your top 10 questions about managing your data responsibly? We also did an environmental scan where we looked at all of the policies, the regulations that were associated. Many universities will have vastly different policies. We amalgamated it and we created a toolkit. Sorry about that. It looks like my internet connection was a little unstable, so I may have frozen up for a moment, but hopefully I'm back now. So this is the components of our toolkit. So we have 4 different things. So we have a digital data management glossary where we give an explanation in lay language of the terms we're using. We have a digital data management frequently asked questions document. So this was based on our original research. We have a digital data management matrix, and we also have a digital data risk matrix. And so I'll talk about each one of those. So starting with the data management glossary, one of the things that we found here was that in conducting our interviews with research ethics board members, with administrators, with researchers, is that in many cases we weren't speaking the same language. So while you might talk to a computer science student about cloud storage and they can, speak intelligently on the matter for an hour, you might have other folks who are using cloud storage but are not necessarily understanding what it is or how it functions. And so we created a glossary that explained those things in the simplest terms possible. And we based that on a few different resources that you see listed here. So here's a sample definition from our glossary. So let's say, I've been talking this whole time about data management plans, and maybe you're sitting there going, I don't even really know what a data management plan is. Well, here's the definition we have. A DMP is a formal statement describing how research data will be managed. So you can see here, we have a section where we're talking very generally about here's what a data management plan is. And if you take a look at the second half of this definition, you'll see it says here, McMaster encourages the use of DMP assisted by portage and talks about the best practices at McMaster. So for the set of tools that we provide to all of our member organizations, we have a section of the definition that's general, that can just stay the same. And we have a highlighted section of the definition that the champion who's taking up these tools will adjust based on their own organizational requirements. So that's what we mean when we say these tools are customizable for your organization. So a couple of sample terms from our glossary include cloud services, data lifecycle, data management plan, data security, data sharing. You can tell that I took this from the D section, but this is just an example of some of the terms that we found we didn't really have a shared vernacular among the research community. So what I mean by de-identification might be significantly different from what you mean by de-identification. So having a shared language was a really important first step. So the next tool that we developed is the Data Management Frequently Asked Questions document. So here's a few samples of the questions that we found in our research were the most pressing for researchers and administrators. So is a password protected laptop a secure place to store my data? How long can or should I keep my data? What's encryption? When and how should I encrypt my data? What's cloud storage? Is it safe to store data on mobile devices? What's the difference between wireless and wired connections? What online survey software should I use? And what's the best way to share data with my co-investigators? So you can see from the kind of questions that we have here, we went pure practical. So we were really looking at, what questions does somebody have in order to be able to get their research started responsibly and ethically tomorrow? And so we looked at the questions that were most likely to have an immediate practical application for researchers. So here's a little sample of one of the responses. So is a password protected laptop a secure place to store my data? We go on to talk about how this is a very common place to store your data, but while it might be secure enough for low risk data, it may not be secure enough for medium and high risk data. And you can see here that those terms are underlined. And that really is, I think, one of the most important aspects of this toolkit is that all of the resources are linked together. So let's say that I'm reading this ethical data management FAQ and I ask, can I store my data on a protected laptop? And I read this and I'm reading about low risk, medium risk, and high risk data. Well, if I click on those links, they'll take me to the data management glossary, which then provides me with a definition. And there are links in the glossary that could link me back to the FAQ, that could also link me to the two matrices that provide me with concrete suggestions for how to manage my data. So you can kind of dig into this as much as you want. If you're a person who's saying, just tell me what to do, I'm not that interested in the details, you might just use the data management matrix. But if you're the kind of person who wants to know the details, who wants to know why, there are all of these embedded links that will allow you to dig down as deep as you want to. So here we talk about some other options, for instance, a portable storage device rather than storing it in your personal password protected laptop. But then we talk about the issues with those. So USB keys can be great because they're portable, they can be secure, but also they can be more easily lost or stolen. They're not meant to be a permanent repository and they degrade. So there are pros and cons. And then we talk a little bit about, hey, even if you're going to store things on your personal password protected laptop, there are things you can do to make that safer. So here we start to talk very basically about good computer hygiene and what that looks like. So trying to give as much information as possible to ensure that people are managing things well. All right, so we've talked about the glossary, we've talked about the FAQ document. The next tool that we have in the toolkit, and I would say by far the most popular tool in the toolkit, is the Research Data Management Matrix. So you can see along the top here, we've divided things into low risk, medium risk, and high risk data. Then if you go along the side, we've provided a definition of what the types of data are. We've provided examples of each of the types of data. And then as you go further down, we talk about every stage of the research data life cycle. So just to go back to that previous slide, actually. So you can see here we start with data protection, but we include data collection, data transfer, data storage, data destruction. And in each case, you would be able to say, I want to know how to store my high-risk data. And if you follow that down the matrix, you'll find that there's a concrete suggestion for here's how you should store your high-risk data. Or if you want to know how to safely collect your low-risk data, you can follow that down and it will tell you here's a concrete suggestion for how to do that securely. So this really is perhaps the most practical. If you're looking for how do I do this, just tell me what to do, this is the tool for you. So here we've talked a bit about low risk data. So here's the definition that we provide. And then we provide some examples. So low risk data might be completely de-identified or anonymous data in some cases, blank consent forms, information gathered from a public facing website. All of this is low risk. And again, you can look at every stage in the life cycle in order to be able to be provided with a suggestion. Again, we have our definition of high-risk data, and we provide some examples of that as well. So information with regard to racial or ethnic origin may be high risk. Information about mental health or your sexual life may be high risk. And again, throughout the data lifecycle, we can say, how do I securely collect my high-risk data? How do I securely transfer my high-risk data to my colleague in another country? And we have concrete suggestions for all of those things. So this is another look at the research data management matrix. As I mentioned, that will go way down the page, so there's a lot more information there. And as you can see here, it contains clickable links so that you can be provided with basic definitions or more information should you want it. Finally, the last tool in the toolkit is our research data risk matrix. So this was really produced because we found that many researchers don't just want to know, what should I do here? So some do. Some just want a suggestion for how to manage their data, but others want to know, why does this matter? Why should I be caring about this? And so here you can see along the top, we talk about the risks to the research subjects, the risks to researchers, the risks to institutions, the risks to the data itself. And finally, we talk about risk management. And there are lots of links here to our other tools. So we talk about all of these different kinds of risks, and then we talk about things that could happen. So unauthorized data access, confidentiality breach, data corruption, data loss. So if you're interested, you could say, well, how does losing my data affect my research participants? How does losing my data affect my institution? And we provide a rationale there for why all of these risks are important to take into account and what the outcome could be. So here's another look. So you can see unauthorized access to data. So what's the risk to my institution if an unauthorized person accesses my data? And we provide an explanation there of what that risk would be. So as I mentioned, we have the connection between the tools, which is a really important aspect of them that allows you to hit the clickable links and dig down, take as much or as little information from these tools as is important for you. And there are a couple of samples of the tools in action here. So if you're curious, again, when we disseminate these slides, you can have a click and have a look at how different organizations have adopted them. So just before I move on to summarizing our objectives, I want to talk just a little bit about the working group. So this is something that's come out of this toolkit. So essentially we developed the toolkit, and this happened at Memorial University. And then I moved back home to Newfoundland, where I was working for a health research ethics board here. And I found that these tools, which were tremendously useful for McMaster, Memorial also needed a set of these tools. And some of the health research organizations I worked with needed a set of these tools. And so I started giving presentations about the toolkit. And every time I gave a presentation, I would have a dozen people come up to me later and say, wow, my organization needs this, or my organization has been working on something similar and we don't want to reinvent the wheel. And so I noticed that I would send out these toolkits to folks, and I contact them, a month later to say, hey, how's it going with the adoption of the toolkit? And almost inevitably, the person would say, well, it's gone nowhere. Well, it got stopped at technology services, or, oh, the policy people had an issue, or, oh, it's just been sitting on the corner of my desk. So what we ended up doing was we put together a working group of organizations with representatives who are all working to have these tools adopted. And one of the very first things that we noticed was that the most important thing right off the bat was to get the right people at the table. So at that initial meeting where you say to your organization, hey, we should adopt these tools, you want to have somebody in policy there. You want to have somebody in administration. You maybe want to have a legal rep. You maybe want to have a technology person. And getting all those people at the table right off the bat is a really great way to head off a number of those problems. So this working group almost became a bit of a support infrastructure, which, we could talk about our successes, we could talk about our failures, we could talk about stumbling blocks and how we had gotten over them. And so we now meet on a fairly regular basis to talk about where everyone is with the adoption of this toolkit. And as I mentioned, we have about 70 organizations at this point. So our phone calls get complicated, but we've still been able to work through it. So, as I mentioned, if you've heard about this toolkit today and this is something you're interested in, get in contact with me and I'm happy to provide you with a copy of the tools. And if you'd like to be a part of the working group, you can also let me know that as well. And I'm very, very happy to add you to the group. So just to go back over everything, we talked about an overview of Canada's current data management landscape and how things are changing, $575 million worth of changing, so worth paying attention to. We talked about the new TCPS2 data management requirements that have been coming down the pipe for a long time and I expect will be dropped relatively soon. And then I provided you with an overview of the data management toolkit and offered you the opportunity to take advantage of it if you're interested. So for more information, you can contact me with the following contact information. I've just started a new position as the Director of Bounce Health Innovation. So I'm really, really looking forward to chatting with people about this project, as well as any other innovative ideas they might have. So you can feel free to contact me anytime, whether you just want a copy of the toolkit, or you want to be a part of the working group, or you just want to talk to a data nerd. So I think that's just about everything for me. So I will stop my share and we'll see if there are any questions.